Imagine a mother in rural Uganda receiving an early diagnosis from an AI tool, one trained on data that reflects her reality, incorporates local health context, language, and intergenerational knowledge. At TeachSomebody, we're building the capacity to make this a possibility. Hi, I'm Dr. Kadian Davis-Owusu, co-founder of TeachSomebody, an LMS advancing adult education. I lead our work on trustworthy AI in healthcare with Kofi, cybersecurity, Evans, software development, Olivia, AI literacy, and Trisha, strategy. Together, we advance trustworthy AI in healthcare through workshops and policy to benefit marginalized African communities. Africa's health systems are under strain. According to WHO, 8 countries have fewer than one doctor per 10,000 people. 70% of global maternal deaths happen in sub-Saharan Africa. Many chronic conditions go undiagnosed due to limited resources. While AI can remedy this by supporting diagnosis and expanding access, most systems are trained on foreign data, causing bias, misdiagnosis, and mistrust. We've delivered responsible AI workshops in Kenya, Uganda, and Tanzania, reaching over 400 participants, including health workers, universities, innovators, and underserved communities. Our work, backed by 2 peer-reviewed papers under review, is shaping university curricula and continental AI strategies to reimagine how trust and safety are taught and governed. Africa's health tech sector was valued at 3.5 billion in early 2022. Yet, there's a deep data gap, limited high-quality representative datasets, and few localized standards for fairness or safety. A 2024 survey found that 83% of the respondents in Africa and the Middle East trust generative AI, and 63% are willing to share their personal data. This trust is promising, but without responsible AI governance, users remain vulnerable to deepfakes, misinformation, and scams. In the next 6 to 12 months, we'll scale our AI, trust and safety, and digital skills workshops in Kenya, Uganda, and Ghana to reach 1,500 people. We'll co-develop region-specific AI in healthcare policies through stakeholder studies. We invite partners to help us co-create a trustworthy, human-centered AI future for Africa. Thank you.